歡迎各位出席今日。
Welcome to the press briefing on the latest measures in relation to social distancing. We have Professor Sophia Chan, Secretary for Food and Health, Mr. Edward Yao, Secretary for Commerce and Economic Development, Mr. Casper Choi, Secretary for Home Affairs. They will first say something, and then they will take questions from the floor. Secretary for Food and Health, please. Good afternoon. Well, in the past week, the epidemic has eased, and on average, there are less than 5 cases per day for local cases, with just 1 or 2 untraceable cases per day on average. And of course, in the past months or so, we've seen outbreak of clusters at restaurant and a fitness center, but we have adopted swift measures for intensive testing and quarantining close contacts. We also received full cooperation from the public, so we managed to contain the spread of the outbreak in a relatively short time. It shows that the various new measures we have rolled out in the 4th wave of the outbreak are effective to a certain extent. These measures include lowering the compulsory testing threshold for residential buildings and workplaces, restriction testing declarations being imposed on the individual buildings, and also requiring regular testings for employees working at high-risk places, setting up the contact tracing office, and also increasing the quarantine and isolation measures and so on. So this has helped to contain the various clusters. Now, the 4th wave of the outbreak has dragged on for 4 months. It's starting to ease, and so this is a hard-earned achievement, and we're grateful to the public for their cooperation. If we want to contain, to keep containing the epidemic and not undo the efforts we've made so far, then we must continue to enforce the various stringent measures mentioned above, and we must also encourage more people to get vaccinated as soon as possible. Now, the experts have reminded us that this is an important or strategic stage. Now, if we ease the measures slightly before the Easter holidays, there could be a resurgence of the epidemic. That's why we do not have the condition now to substantially relax the various social distancing measures and immigration control measures. We must keep patient. We must keep up our effort for a little longer. And so during the Easter holidays, we must continue to observe the various social distancing measures, so we are able to stamp out the 4th wave of the outbreak altogether and achieve zero infection as soon as possible. And also, when the vaccinated population reaches a relatively high level, then it's possible that there could be the so-called herd immunity achieved in the community, and then we could go back to our normal life. For the latest round of social distancing measures, most of the existing measures will be maintained. Because, as I've mentioned, we have various considerations, and most of the social distancing measures will expire this Wednesday on the 31st of March, and most of the measures will be extended by another 14 days to the 14th of April, Wednesday. I hope you appreciate there is need for us to remain prudent, because it's after many months of hard work of the community as a whole that we're able to keep the epidemic under control slowly now. So with any adjustment of the policies, we must first regard to the public health risk assessment, and when the measures must be precise and targeted, we must not become complacent in any way. Now, of course, the Easter holidays are just around the corner. People may want to engage in various activities, physical and other activities. So we have carefully considered the infection risk, and we will allow the resumption of certain low-risk activities with conditions starting from the 1st of April, Thursday. First of all, various public and swimming pools could be reopened upon the adoption of series of infection control measures. Now, because the risk of transmission in water is relatively low, so by reopening the swimming pools and beaches, and we'll allow recreational venue for different type of recreation venue for the public, and also for cinemas and performing venues. The cap will be uplifted to 75% of the total capacity, but other infection control measures remain in place. The Secretary for Home Affairs and the SED will supplement later. Now, in the past months, we've seen 2 clusters involving a restaurant and a fitness center, but then we understand that the relevant sector has been observing duly the indoor air exchange requirement and also other infection control measures. So we have no plan to tighten these measures, but then the relevant department will step up enforcement. As for the requirement on other scheduled premises, the requirements will remain in place. That is for bars, pubs, bath houses, party rooms, clubs, nightclubs, karaoke places, and the mahjong parlors. These are considered high-risk places, so they will remain closed. The relevant bureau will continue their discussion with the individual sectors to see where there is condition to gradually relax the restrictions on certain premises or activities while maintaining infection control. Now, we also recommend to the Chief Executive Council, as soon as possible, to exempt religious activities under CAP 599G, that is Prevention and Control of Disease, Prohibition on Group Gathering Regulation. But then there will be a cap on the number of persons involved to not more than 30% of the venue capacity. And certain activities will not be allowed, such as eating and drinking, religious rituals, such as the Holy Communion. And if the Chief Executive endorses the measure, it could be implemented soonest on the 31st of March, Wednesday. As for the arrival arrangement for people coming to Hong Kong, now because we are at a critical stage of the local epidemic and also the pandemic remains dire around the world, and new strains, the importation of new strains of virus could be a hidden danger that will lead to a resurgence of the epidemic. That's why we have to be very vigilant about prevent imported cases. At the same time, we know that we've had very stringent boarding arrangements or restrictions, as well as compulsory testing requirement, and this does impact upon the local residents who want to come back to Hong Kong. So we will have regard to the latest development of individual places and adjust the relevant boarding and compulsory testing requirements. First of all, for people who have stayed in Hong Kong, the United Kingdom for more than 2 hours, within 21 days of boarding a plane, they will not be allowed to board the plane. But we've had regard to the declining cases in the UK, and also we've had regard to the vaccination rate in the UK, so we will remove such a boarding restriction. But to make sure that we could still guard against infection control, we will be arranging with some airliners to arrange designated scheduled flights from the second half of April. So people could take these designated direct flights to Hong Kong, and once they arrive in Hong Kong, they have to stay at a single specified hotel, designated hotel, for quarantine for 21 days. And then, of course, they must observe the hold and test arrangement at the airport. And then on the 7th day, 12th day, and 19th day upon arrival, they must take a test. The government will be announcing more details later. As for people coming from low-risk places, and here we're talking about both Hong Kong or non-Hong Kong residents, the mandatory quarantine period will be adjusted from the current 21 days to 14 days at a hotel, a designated hotel. After that, there will be 7 days of self-monitoring. And then on the 19th day, they must also take a test. Again, this is a compulsory test. For low-risk places, initially, this will include Australia, New Zealand, and Singapore. The key consideration, of course, is that for these low-risk places, the epidemic situation is stable, so we could gradually relax the travel restrictions, and this will help the resumption of travel between Hong Kong and these places, and also the discussion on the travel bubble arrangement. In particular, for those who have been vaccinated, we could consider certain facilitation measures for them. For people arriving from high-risk places, they must still observe the current requirement, that is, they must be quarantined at a designated hotel for 14 days. As for those arriving from medium-risk places, if they've been vaccinated, then they need to go into compulsory quarantine at a designated hotel for 14 days. And then afterwards, there will be 7 days of self-monitoring, and they have to take a test on the 19th day. So the arrangement is the same as for those arriving from low-risk places. As for people who have not yet been vaccinated, then they must still stay at a designated quarantine hotel for 21 days on a compulsory basis. Of course, on what I have mentioned, it also depends on whether there will be any changes in the epidemic situation in the place involved. So we will continue with our assessment of the risk level at different places. For the return to Hong Kong scheme, is worked well. It's not brought additional risk to our epidemic situation. Now, the situation on the mainland has remained stable for some time, so the administration will consider further extending the coverage of the scheme, including Hong Kong residents who arrive from the mainland through the airport. And then we will consider the various extension scheme and so on. The Constitution and Mainland Affairs Bureau is actually working at full speed on the various arrangements, and they will make announcements when there are details.
Turning now to vaccines. This is a good opportunity. As I said, globally, COVID is still raging. Vaccine rollout has already started in many jurisdictions, and this is providing a good opportunity to adjust the COVID infection control measures. Getting the jab will protect yourself and also your friends and your loved ones. If we get a significant number of people who are getting the jab, we will be able to achieve herd immunity, and this will be a pathway out of COVID. In order to encourage more people to get the jab, for those who have taken the second dose of the jab, and after 14 days of the second jab, we will incorporate them into the control measures. Now, for those who have already taken 2 doses of the jab plus 14 days, that would be considered as having been vaccinated. At the moment, there are food establishments and other scheduled premises and RCHEs and RCHDs that have already been covered in the testing program. And for those staff members who are working in these places who have got the jab, and they will be deemed as in compliance with the regular testing arrangement, and the regular testing will be waived. And that is 2 jabs after 14 days, and these people will be considered as vaccinated. The Education Bureau has announced that depending on the actual situation, they will consider allowing the schools to resume half-day in-person classes. For the teaching staff who have already got vaccinated, they would be regarded as in compliance with the regular testing requirement. The Development Bureau will be talking with the construction trade to encourage the practitioners to get the jab in place of the regular testing arrangement. With the vaccination, we will be able to have the protection bubble, and within the bubble, we can appropriately relax the restrictions like the visitation for nursing homes and hospitals. For public hospitals, we are considering those vaccinated people to provide the rapid antigen test and also a negative result to be allowed to visit the hospitals. The hospital authority will be announcing the details shortly. We are reaching a critical moment in our COVID work. We cannot slacken our effort. Vaccination commands the top priority. The more people who get a jab, the more effective it will be. When we get a significant proportion of the people who've got the jab, we will be able to achieve good protection or herd immunity. At this present rate of vaccination, there is still some way to go. In order to encourage more people to get the jab, we are considering that given a significant proportion of the people who get vaccinated, we can further adjust the social distancing measures. We are considering this at the moment. Once again, I'd like to urge all of you to get the jab for the protection of yourself and others.
Mr. Edward Yao, please. As Professor Chen said, we are now at a critical stage of our fight against the epidemic. Now, we're glad to see that we're making progress in our fight against the virus. The situation is slowly being brought under control. Then we do appreciate that for different sectors in the community, especially commercial operations, they're facing immense challenges. So we keep up our communication with these sectors, and where the epidemic is under control and where the condition allows, we will gradually relax certain control measures. From the, on around the 1st of April for cinemas and theme parks, we will relax the attendance rate from 50% to 70% of the venue capacity. But of course, all the infection control measures must be in place, such as about personal hygiene and distancing and so on. And then some cinemas have operators have suggested allowing eating and drinking in cinema, but because people have to wear a mask, so we cannot really relax this restriction yet. And then we've talked to the tourism sector to see certain relaxation is possible. Now, for practitioners in the tourism sector, they are happy to accept the precondition of vaccination and compulsory testing. Many in the tourism sector have actually started taking the vaccine. So could vaccination be made the starting point for the relaxation measures? Well, the sector has expressed certain reservations, so we're still in discussion with them. On the immigration, arrival arrangement, now there are 3 low-risk places: Singapore, Australia, and New Zealand. For Hong Kong residents and non-Hong Kong residents, if they arrive at Hong Kong, the quarantine period will be shortened from 21 days to 14 days. That is an important step because it will help us to slowly resume travel with other places. So this is a step forward in that direction. And of course, we earlier sometime we've been in discussion with different places and countries for bilateral travel agreement. That is what we call the travel bubble. As you know, in November last year, we were about to start the travel bubble arrangement with Singapore. And now, recently, we've seen improvement in the epidemic situation. The average 7-day figure has dropped from early March to the number of cases less than 5, which is the trigger point for us. So we have resumed discussion with the Singaporean government on the travel bubble arrangement. And then with another more than 10 other countries and places, we've explored the travel bubble arrangement with them. And in fact, there are in total 16 countries. We've written to some of the countries that are doing better, such as Japan, Korea, Thailand, Vietnam, New Zealand. Their epidemic is, has eased substantially, so we will resume discussion with them. But of course, depends on the actual epidemic situation at the time. For Singapore, there are two conditions for the bubble travel arrangement. One is testing on both sides. That is, before departure and after arrival, there's a need for a test each time. And as Professor Chen said, well, there is now a vaccination program, and we have enough vaccines for the whole population. So under the travel bubble arrangement, if Hong Kong people are to travel, and if we are to start any travel bubble arrangements with other places, then vaccination will be a requirement. This is for our own protection. I believe that will be the trend around the world in the long run. So we, along this time, we will keep up our discussion with different places. Now, of course, we've been in touch with local trade associations and the sectors. They are keen to see the economy resuming normal with the various infection measures in place. So we will keep up our discussion with them. Mr. Casper Choi, please.
Thank you very much. I'd like to take this opportunity to thank the people of Hong Kong who have introduced the social distancing measures and other measures. We get the forbearance of the members of the public with the concerted efforts of everyone. And in fact, many sectors are prepared to go the extra miles. We've seen that the COVID situation has stabilized of late in our contact with different sectors. One of the things that we saw is the importance of the physical and mental well-being. We liaised with the religious organizations. We heard a lot of suggestions that given the circumstances that they would like to resume some of the religious activities. They are all aware of the COVID measures and the protocol, and there should be a balance that there should be struck. The religious organizations said after our contact with them, like to impose a ceiling on the number of attendants. Professor Chen has already mentioned that. I don't propose to repeat it. The religious organizations have been opened before, and they will be taking on board the health protocol suggested by CHP, and they would also be putting together the detailed guidelines pertaining to their own religions. There will be very specific requirements like keeping the mask on, keeping social distancing, and so on. I'm grateful to the religious leaders for their cooperation. They have already prepared the guidelines, and they will be publicized pretty soon. And arrangements are being made with the religious venues for measures to be undertaken in order to prepare for the resumption of the activities. We hope that the measures will be implemented and the members of the public will be able to take part in religious activities. Turning now to sports activities. In February, we have opened some of the indoor and outdoor sports facilities, and we are prepared to have a further relaxation. The LCSD will progressively open up some of the facilities, like most of the public swimming pools, beaches, the children play facilities, museums and libraries, and so on. Later on, we will be publicizing the details. Now, for the performing venues, so that are licensed, like cinemas, there will be a relaxation from 50% to 75% in terms of the ceiling of attendance. We will be announcing more details through the LCSD later on. I'd like to take this opportunity to thank the different sectors who are cooperating with us closely. Some are prepared to do more to make sure the risk can be reduced to a bare minimum. And I'm grateful to different sectors and the members of the public for their forbearance. As Professor said, this is a critical moment for Hong Kong. In the days to come, the members of the public should observe all the social distancing protocol, and the government will also step up enforcement and inspection to make sure that everyone is going to be in compliance. And we should also encourage the members of the public to get the jab in order to fight COVID together.
Okay, now the floor is open to questions. When you're asked to raise questions, please first give us the name of your organization, and please limit yourself to 3 questions. The gentleman in black. I'm from Apple Daily. Professor Chen, you said just now, if the vaccination rate is good enough, then you may consider relaxing the social distancing measures. Do you have any timetable, or have you set the level? That is, how many people have to be vaccinated in Hong Kong before you would consider relaxing the measures? Is there a timetable for that? And a question for Mr. Yao and Mr. Choi, too. Now, Mr. Yao, in your discussion with the Singaporean government about the travel bubble arrangement, vaccination will be a prerequisite. Now, has the Singaporean government, endorsed the Sinovac vaccine, or would people have to take the BioNTech vaccine? And the third question, sorry, the press briefing here is on infection control measures, so we'll limit the questions to infection control. Professor Chan, please. First question. Yeah, thank you for your question. As I said in my opening remarks, the epidemic may have eased in Hong Kong, but we've had a restaurant cluster and a fitness center cluster after when we previously relaxed the social distancing measures. And now we have actually lowered the threshold for compulsory testing. We have increased substantial manpower to do contact tracing. We also have many more testing measures and so on. And for the fitness center cluster, we have put many of the close contacts in quarantine centers, and we've also imposed compulsory testing. So we have adopted various new measures. So that's why we are confident now we'll be able to handle large outbreaks for the time being. But on top of that, there could still be sporadic clusters every now and then. So we are not in a position to have a substantial relaxation of the measures. Now, under Cap 599F, there are scheduled premises that have been allowed to reopen. So these measures will remain in place. And then for activities that would benefit the minor and the body, we will relax those measures also in a suitable manner. But at the same time, we remain concerned about activities that where masks could not be worn. Now, of course, in indoor places, whether there is good ventilation and sufficient air exchange is also a factor of concern to us. And so these are matters we are considering at the moment. And then experts have told us the coming 14 days are a critical stage. There is therefore no condition for substantial relaxation of the various measures. So for other scheduled premises under Cap 599F, they will remain closed for the time being. But then, as I have said, vaccination actually would present an opportunity to us. It's not just about relaxing social distancing measures. It's also about resuming travel and the length of quarantine and the testing requirement and so on. So the vaccination may allow room for changes in these various areas. That's why we have encouraged the public to take the vaccine. And we've also said that if people get vaccinated, then we could say for certain at this point in time that for, say, premises under CAP 599F, employees have to take regular tests. But if they get vaccinated, then they could be exempted from the compulsory regular test. And by vaccination, we mean 2 doses plus 14 days after the second dose. Mr. Edward Yao. Now, about the question on travel bubble. I hope you appreciate this. Our travel bubble arrangements between 2 places or more places is about forming a bubble, say between the 2 or 3 or how many number of places. So it's like a protection bubble, that covers these places. So if we want to set up travel bubble with other places, there are some basic conditions that need to be met first. Both sides are happy with the epidemic situation in the 2 places. And secondly, before the departure for the travel bubble destination, that the traveler must not have left his or her own city for 14 days before that. And the third point is the testing on both sides. That is, testing before departure and testing after arrival before a traveler is allowed to leave the airport. And then, of course, the flights must also be direct flights, scheduled flights, or designated flights, rather. So, with such arrangements in place, then the people between the 2 places could make use of the travel bubble arrangement. And of course, we see that more places have rolled out vaccination program around the world. And in Hong Kong, we have the vaccination program too, and now we have enough vaccines to cover their entire population. So as an additional protection, we hope that for Hong Kong residents who take part in the travel bubble arrangement could complete the 2 doses of vaccination and travel only after 14 days later. That would be an added protection for Hong Kong residents. So we have put forward a proposal to the Singaporean government. We're waiting for the response. But I think it's important that we first get things right on our side. That is, before people here in Hong Kong travel, they must first be vaccinated. This is for their own protection. And as I have explained earlier, now, before, we have vaccination, we have testing on both sides, and then there would be, dedicated flights and so on. Then that we will have this additional condition to give the added protection. Next, please, on the 3rd row, the gentleman in a shirt.
THK. Firstly, Sophia Chan. On the easing of some of the restrictions before the Easter holidays, I mean, you've mentioned that it's a very critical period, so why couldn't we have waited just till after the holiday before easing the restrictions at some of these venues? Secondly, on sort of the vaccination exemptions, is there any consideration about exempting people who have been vaccinated, that's 2 jabs plus 14 days, from maybe the mandatory close contact quarantining as well? Do you have any info on when the BioNTech jab might also be available back in Hong Kong? And thirdly, on the travel arrangements, I think the colleague was asking that as well. Is there any consideration as to the choice of vaccine that people take, opening up where they'll be able to travel in the future?
Professor Chan, please.
Okay, thank you for your question, Richard. First of all, as I've said earlier, we are very, very careful in terms of our social distancing measures. So we are basically not relaxing. We are just really adjusting some of the situation that we have already, for example, opened. For example, the theme parks and also some of the places whereby we have assessed very carefully the risk, where the risk is not high. So therefore, we think in the coming 14 days, there are some situations whereby there can be some adjustments. As far as the CAP 599F scheduled premises, so we maintain largely what is already relaxed. And we, although we noted that after our relaxation, our earlier relaxation, there are clusters in the restaurants as well as the gym. But given all our stringent measures and also the increased capacity that we have built up throughout the last few months in terms of testing, in terms of contact tracing, and also in terms of our facilities capacity. So we are confident that if there are these major outbreaks, we would be able to deal with it. And so therefore we decide to maintain and not close down these scheduled premises. So this is our position. As far as the exemption is concerned regarding the 14-day, every 14-day regular testing, with the enough supply of vaccination of vaccines in Hong Kong, and also with the consolidation of all the work that we have done so far, and also with the risk assessment, we have come to terms that if people have vaccinated, that they can replace the regular testing, the 14-day regular testing in the scheduled premises under the CAP 599F. We've also said that because we have also communicated with the Education Bureau and also Development Bureau, so therefore for the teachers, if again, if they have get vaccinated, then it can also replace their current testing arrangements, and the same with the construction workers. As far as BioNTech is concerned, I think during the weekend we have already sent out a press release to state the current situation. So the Department of Health and the Food and Health Bureau has been working very, very closely with Fosun and also BioNTech. First of all, they have already confirmed that the situation that we have identified, some of the packaging defects that we have identified would not have anything to do with the safety of the vaccine. But of course, there are some testing going on, and also we hope, and they have already told us that hopefully within the coming week that we are able to have a final report, and so hopefully we can resume the vaccination shortly. The third question is about travel arrangements, right? It's about whether places would how do each country look at the type of vaccine that people have vaccinated. I think as far as the overall understanding is concerned, first of all, if there is any people coming from abroad to Hong Kong, how are we going to confirm that they are vaccinated? I think obviously we would have to look at what are the type of vaccine that is authorized by their country. I think this is the most important, that whatever vaccine people are vaccinated, they are authorized by the health authority of the country concerned.
好，下一條。嗰邊第三行着。
The lady in the third row in black vest, please.
Morning Post. So, first of all, about the adjustment of social distancing measures, experts have said that currently the epidemic situation in Hong Kong is still not yet stable. Professor Chen, are you worried that such adjustments will lead to a quick rebound of infections? And on the shortening of quarantine period for people from low risk countries, when will such arrangement come into effect? And also about the arrangement of bringing back stranded Hong Kongers in the UK in late April. Approximately how many flights and how many Hong Kongers that are expected to be benefit from this arrangement as well? And also on the BioNTech vaccine, Professor Chen, you just mentioned that we are seeing possibly a final report in the coming week. But could you tell Hong Kong people when they could receive the BioNTech vaccine again at the earliest time? Because such supply would actually affect the vaccination rate in Hong Kong as well. Thank you.
Okay, a few questions. First of all, as I've said earlier, the announcement of our continuation of the social distancing measures is not a relaxation. So we are doing minor adjustments on, some of the activities that we have very carefully assessed the risk, and this is also something that is related to people's mental health, and also, so not only are we looking at physical health, but we are very, very careful about the scheduled premises. So therefore, we want to maintain the current scheduled premises opening and not to open any more at this point in time further. Any scheduled premises, as the coming 14 days is critical and also crucial in terms of our efforts, sustaining our efforts to control the epidemic situation, as well, hopefully to strive at zero cases. So that's number one. Number two, your question about when will the low-risk countries, when can we start the reduction of quarantine on the low-risk countries? So I think within this week we will send out more details about the reduction of quarantine period. So not only with the reduction of the quarantine period from 21 days to 14 days, but we have also put in place testing. For example, testing on day 19, and also they must all go through test and hold at the airport, and also plus 14 days, plus self-monitoring for another 7 days, and so on and so forth. So we will announce the details sometime within this week, and hopefully we can start within next week. So about in 2 weeks' time. Third is about the UK situation. Yes, we have now agreed that the people who are stranded in the UK, or earlier we have this boarding restriction. We are going to lift that boarding restriction, and people who are coming back, we are working very closely with the airline to have a few flights for these people to come back to Hong Kong. So it would take some time. Hopefully it would happen towards the end of April, but we are still working very closely with the airlines. Again, we are also putting in further restrictions for example, test and hold at the airport, and also regular testing at day 7, day 12, and day 19, and they must all be quarantined in a designated hotel for 21 days, and so on and so forth. Again, within this week we will issue a press release to give out all the details. Finally, your question about BioNTech. Yes, as I've said, we hope to, we are actually communicating with them more than once per day. So we are working very, very closely with them to ensure that they give us their report as soon as possible, because this suspension is ordered by the manufacturer. So we have to work with them very closely. So we have already issued the press release, and the initial findings is reassuring. And so therefore, we hope to resume the injection obviously, hopefully within this week. But at this point in time, I cannot say, which day of the week, because we still have not get their report at this point in time. But we will chase, after them almost every hour. Thank you.
最後兩條。
Last two questions. The lady in black over here, please. RTHK. Experts said that in the coming 2 weeks, it will be critical for us to bring the caseload down to zero. Have you consulted experts regarding these new measures? We still have some sporadic cases in Hong Kong. And how do you assess the risks between Hong Kong and the mainland and other places? And also, other countries rolled out the vaccine passport. They only recognize anything but the Sinovac vaccine. Would there be any specification regarding the type of vaccine in the vaccine passport? And also the swimming pool, what is the arrangement like? Professor, first of all, let me reiterate that with regard to the social distancing measures that we are maintaining, that this is by no means a relaxation. We have deliberated on the risk. We have conducted risk assessment. We have liaised with the various sectors. Of course, we also liaised with the experts. It is after all these deliberations that we made the announcement. As you notice, the experts said that the coming fortnight is going to be very critical, and all the premises that remain closed will continue to be closed. For the premises that are opened, we will step up the enforcement work. As you notice, after the relaxation, there are still some outbreak of clusters. I'm talking about the premises under 599F. So we are particularly concerned about this. The sectors are also particularly concerned about it. So in terms of the infection control measures and air exchanges, and also a Leave Home Safe app and contact tracing and so on, I'm sure that the sectors and the members of the public will cooperate to make sure that we will be able to resume our normal life. And we don't really to see COVID becoming too fickle and contribute to major outbreaks. So we will be monitoring the situation continuously. I noticed that globally, with vaccine rollout, many jurisdictions are resorting to this as the basis to reopen the boundaries for tourism. So as I said, in terms of the travel bubble, we would like the people of Hong Kong to get the jab before they travel out. Professor Chen has already addressed the question. In terms of recognition of a vaccine, I'm sure that the health authorities in different jurisdictions will have their own standards to protect their people. We will respect this. When we discuss with various places about the travel bubble, we will have regard to the vaccination as the starting point, and we will consult the health authorities in the respective areas and discuss the mutual recognition issue.
On swimming pool, that's 30% of the venue capacity because you want to reduce the risk. So before people go into the water or come with water, they must wear a mask. And we will be announcing the details. Last question on the third row, the lady in a brown jacket. I'm from Oriental Daily. My first question is about the travel bubble. Is there any timetable? Now, what if people don't take the vaccines? Then can they still take part in the travel bubble arrangement with the initial conditions, or must they now take the vaccine? And second question is for teaching staff, the relaxation is for half a day but not full day. Why? And then what about bars and clubs? Have you talked to them about the conditions for reopening business? Some bars said they're willing to make customers use a straw to drink. Is it true? And then for there is also, there are words saying that the government will create 2,000 jobs for those in the tourism sector who are now unemployed, and they can work at the various vaccination centers. Is that true? Mr. Yao, I'll take the second and the third questions first. First, about the timetable. Now, we've only just come out of the fourth wave of the epidemic, and as Professor Chen said, this is a critical stage. We have to make sure that the epidemic is brought under further control, so we must proceed with caution. But then we are not just sitting on our hands in the interim. We are in active discussion with other governments. And in fact, some governments have inquired about the situation in Hong Kong. Take Hong Kong and Singapore as an example, because in November last year, we have already worked out some sort of a framework. So the condition is therefore easier for us to resume discussion. Hong Kong people taking part in the travel bubble arrangement, as Professor Chen said, it means taking 2 doses of vaccination and traveling only after 14 days after the second dose. Now that means there will still be some time, and so as we have discussion with other places, including Singapore, we will consider the arrangement and we'll make the announcement on the actual details, so people could prepare early for resumption of travel after taking the vaccines. Now, about asking workers in the tourism sector to help with the testing and vaccination effort. Well, actually last year, we have said that we would create jobs. The government has said it would create 30,000 temporary jobs. And of course, the tourism sector is facing a really tough time. It's not even just about unemployment, and many have to switch to other trades. Now, because those working in the tourism sector mostly to do with receiving people, so that's why we are trying to work out with the sector as to whether we could engage some of the workers to help with work that needs to come into contact with the public. Now, some discussion started, so it's a good beginning. If the sector could help, then we could provide some jobs that helps the sector and that helps our and fight against the epidemic too. Now, for bars and other scheduled premises that remain closed under Cap 599F, we've been doing risk assessment all along, and there is no condition to reopen these premises at this point in time. And when the condition is there, do we need to impose any requirements to minimize the risk after these premises are reopened? Well, that's something we are considering. I believe the Revenue Policy Bureau will continue the discussion with the sectors concerned. But I think the precondition is not about what approach we take, but rather the next 14 days are critical. So we are in no position to reopen any other premises. That's the end of the press briefing. Thank you.